Hello and welcome. This is A&P Live Studio, and I'm your host. As a registered nurse and anatomy and physiology instructor, I teach advanced level healthcare pros. Just a quick reminder, this presentation is for sheer education. It is not for any medical diagnoses or decision-making regarding your physical condition. Today, we're going to explore the journey of kidney failure, from what's happening deep inside the cells all the way to what we see in the clinic.
To really get a handle on a condition like this, I think it's always best to start with a patient's story. So let's meet Mr. Chen. He's a 62-year-old retired accountant who absolutely loves spending time with his grandkids. But lately, something's been off. He just hasn't felt like himself. It's also worth noting that his heritage places him in a demographic with a higher risk for kidney disease, which is often tied to higher rates of things like diabetes and hypertension. So for the past few weeks, Mr. Chen has just been feeling more and more unwell, and it's finally brought him to the clinic. He's describing this overwhelming fatigue that just completely drains him. He says his feet and ankles are so swollen, it's a struggle to even put on his shoes. He gets short of breath after just a few steps, and then there are these other strange things. A persistent nagging itch all over his body, and a weird metallic taste in his mouth that's ruining his favorite foods. As you can probably guess, these are all classic red flags for advanced kidney disease.
Okay, so here's our game plan. We're going to follow Mr. Chen's journey. We'll start with a quick refresher on what healthy kidneys do, and then we'll get into what happens when those filters start to fail. We'll connect all that science right back to Mr. Chen's symptoms, talk about the consequences for the whole body, and then finally, we'll see how this condition is diagnosed and treated with therapies like dialysis. So before we can really understand what's gone wrong for Mr. Chen, we have to appreciate just how amazing the kidneys are when they're working right. I mean, they do so much more than just make urine. Healthy kidneys are basically the body's ultimate quality control managers. Think about it. They filter about half a cup of blood every single minute, pulling out waste products and extra water. They keep our electrolytes like potassium and sodium in perfect balance, which is absolutely critical for our nerves and muscles. They also help control our blood pressure. They produce a hormone that tells our bone marrow to make red blood cells. And they even activate vitamin D to keep our bones strong. They are truly incredible organs. End-stage renal disease, or ESRD, is what happens when this amazing system finally breaks down, and that breakdown is usually irreversible. So let's trace the path that leads to this failure. For most people like Mr. Chen, who has a history of type 2 diabetes and high blood pressure, kidney failure doesn't happen overnight. It's a slow, gradual process. It starts with the loss of the kidney's tiny filtering units, the nephrons. Now, the remaining healthy nephrons, they try to be heroes. They pick up the slack and work way harder. We call this compensatory hyperfiltration. But that kind of sustained stress is damaging. Over time, it leads to scarring and hardening of those little filters. That's called glomerulosclerosis and the tissue around them. Eventually, you hit a tipping point where so many nephrons are gone that the kidneys just can't keep up, and waste products build up in the blood to toxic levels. We call that state uremia. And this process at the cellular level, it explains every single thing Mr. Chen is feeling. The swollen ankles, that's edema. His kidneys can't get rid of the extra fluid and sodium. That deep, profound fatigue, that's anemia. His failing kidneys aren't making enough erythropoietin, so he's not making enough red blood cells. The crazy itching, that's from all the uremic toxins being deposited in his skin. And his shortness of breath, well, all that extra fluid is now backing up into his lungs. And that metallic taste, that's a direct result of urea building up in his blood. See how it all connects? Because the kidneys are so central to keeping the body in balance, their failure creates this ripple effect of dangerous consequences through almost every other system in the body. One of the most immediate dangers is hyperkalemia. That's a high level of potassium in the blood, which can cause deadly heart rhythms. Long-term, heart disease is a huge risk, fueled by high blood pressure and fluid overload. The body's inability to handle phosphate and activate vitamin D leads to weak bones, what we call mineral bone disorder. That uremic state also weakens the immune system, leaving patients open to all sorts of infections. And in really severe cases, those uremic toxins can even inflame the sac around the heart, a condition called pericarditis. So, how do we know for sure that Mr. Chen's kidneys have reached this final stage? Well, we rely on some key lab tests to measure just how much function is left. The two main tools in our toolbox are blood and urine tests. A urine test can show us things like protein leaking through, which is a sure sign the filters are damaged. But the really crucial number comes from a blood test. We measure a waste product called creatinine. Now, creatinine is produced by our muscles at a pretty steady rate, so by measuring it in the blood, we can calculate something called the glomerular filtration rate, or GFR. And the GFR is really the gold standard. It tells us exactly how well the kidneys are filtering the blood. Mr. Chen's lab results come back, and his GFR is below 15. That number confirms it. He's in stage 5 kidney disease, which is what we call end-stage renal disease. At this point, his kidneys have lost over 85% of their function. They simply can't keep him alive on their own anymore. And that brings us to a really critical question, right? When the body's own amazing, sophisticated filters have failed, how on earth can we replicate that function to keep someone alive? Well, the answer lies in some pretty remarkable technology. For patients like Mr. Chen, the main intervention is called renal replacement therapy. And most of the time, that means dialysis. It's a treatment that essentially acts as an artificial kidney. And it really is a lifeline. Just in the United States, there are over 750,000 people who depend on either dialysis or a kidney transplant to live. For most of them, this means spending several hours, 3 or 4 days a week, hooked up to a machine. This machine, the modern hemodialysis machine, is truly a technological marvel. It's designed to do the hard work of filtration that the patient's own kidneys just can't do anymore. But how does it actually work? How does it clean the blood? Let's break down the basic principles. Blood is gently pumped out of the patient's body and through a special filter called a dialyzer. Inside that filter, the blood flows on one side of a very thin, semi-permeable membrane. On the other side, a special cleaning fluid called dialysate is flowing. Because waste products are so concentrated in the blood, they naturally move across that membrane into the dialysate. That's diffusion. At the same time, we use pressure to gently squeeze the excess water out of the blood. That's ultrafiltration. Then the clean, filtered blood is returned to the body. You know, the history behind this technology is pretty fascinating. The basic idea goes all the way back to 1913. The first successful human treatment happened in 1945. A doctor named Willem Kolff saved a woman who was in a uremic coma. But the real game changer for long-term treatment was the Scribner shunt in 1960, which finally gave doctors a way to repeatedly access a patient's bloodstream. Of course, this created a huge ethical problem. There were very few machines, so committees literally had to decide who got treatment and who didn't. That terrible era of rationing ended here in the US in 1972, when the government established the ESRD program, which made dialysis available to just about everyone who needs it. And one of the key pieces of that long-term treatment, which came from those early shunts, is what we call an arteriovenous, or AV, fistula. A surgeon makes a direct connection between an artery and a vein, usually in the patient's arm. This makes the vein get bigger and stronger, creating this really robust access point that can handle the repeated needle sticks and the high rates of blood flow you need for good dialysis. So let's bring it all back together. We started with healthy kidneys, the body's master regulators. We saw how chronic diseases can lead to that progressive loss of nephrons and that toxic state of uremia. We then connected that science directly to the symptoms Mr. Chen was experiencing. And finally, we saw how the incredible technology of dialysis can step in and artificially do the kidney's most important job, filtration. This whole journey from normal physiology to life-saving technology leaves us with a big question to think about. As we get better and better at sustaining life with things like artificial organs, what new challenges, both physiological and ethical, will the next generation of healthcare professionals have to face? Just a final reminder, this presentation is for educational purposes only and is not intended as medical advice.